Are you whitening your teeth the right way? Do you think that teeth whitening products are going to destroy your enamel? If these are your questions, make sure you listen to this episode. And before I keep going, make sure you put code 80. This is to get a free consultation for teeth whitening or porcelain veneers from our office in Princeton, New Jersey. And make sure you like, subscribe, and comment down here below if you have any questions. My name is Dr. Radwa Saad, and I am your host today. And well, a little bit about myself. I have been a dentist for over 20 years. I've done it all. I'm a general dentist, but I have specialty in cosmetic dentistry, like porcelain veneer, smile makeover, and I also place implant. I have a master's degree in implant placement and restoration from the International Congress of Oral Implantologists, and I am the past president of Mercer Dental Society. I'm still on the executive board, and I am a national speaker for a big dental company. And let's talk about teeth whitening. So everybody wants white teeth, you know, beautiful white pearly teeth and beautiful smiles. And this is all I do every day. You know, I'm putting smiles every single day on my patients' faces, basically. So teeth whitening, there is a lot of myth and there is a lot of facts. So a lot of my patients, they come and they're like, is it gonna hurt me? Like, is it gonna cause a lot of sensitivity? Is the sensitivity permanent? Am I a good candidate for this? So first of all, let's just break it down to a few things now. So there are different types of teeth whitening. There are like pretty much like 5 types of teeth whitening. And these are just the big categories. And of course, in the middle, like there is like a million brands. But the biggest ones basically are the in-office, the professional teeth whitening. This is when you go to the dentist and, you know, you want like really white teeth in a fraction of time. And this is very effective if you have a big event, like you have like a prom or you have a big wedding or you're applying for a big job and this is your dream job and you want to look, you know, presentable. So the in-office teeth whitening is the thing for you. This is the right choice for you. And how does it work? You basically, you know, sit under that light it takes around an hour and a half, because this is not just done like, oh, we put some gel and let you go. No, it takes like a lot of preparation. So I'll explain it to you guys. So we have to basically protect the cheeks, we have to protect the gums, and we have to protect your eyes, and we have to give you certain glasses to wear. And this, and even when we are applying the gel, it has to be done in a very, very specific way so it doesn't damage your gums. And I'm pretty sure some patients or some of the listeners out there, somebody had some teeth whitening and it affected their gums. Am I right? If that's the case, write it down here below in the comments and let me know. But this is the in-office teeth whitening, and it has to be done by a dental professional, not like at home, like just get it done at a dental professional, especially if you have a big event. And basically the change in your, the shade of your teeth, actually it changes dramatically. So you can go between 4 shades to probably like 6 or 7 shades lighter, which is pretty big. Now, some of us, I mean, our teeth are not really white to begin with. Some of it like genetic, but the teeth, actually the shades of the teeth, it ranges from yellowish to grayish to even bluish. And I'm talking like white, yellowish, white, grayish, like, you know, white, bluish. So if you have the yellowish tone, you know, your teeth are going to be very effective, you know, if you get some whitening done. The grayish or the bluish, you might need to have extra sessions to get that done. They're still going to get white, but they're not going to be dramatically white like, you know, if you had, you know, the tone a bit yellowish, if that makes sense. And that's because of the density. It has something to do with the density of the enamel. Now, so the first category now is the in-office, the professional teeth whitening, which works really like charm. I just had a patient last week and he had it done and he looked at himself. Well, his teeth were glowing, let me tell you. I think his teeth were lighter than the bleaching shade that we even have. It was like, he was so happy. And he had a big event. So he was like, I couldn't ask for more. So this is one category. The second category is if you have the custom trays and then you get the gel and you do it at home. But the custom trays, they have to be done, you know, like at the dentist office as well. The good thing with this, you actually get to keep the trays. So we just take a mold if we are scanning, or if you're gonna take an actual mold of your teeth, and we fabricate that little, it's a little plastic tray. It's a little moldable, and then you basically, you buy the gel, and it's a whitening gel, and you better also get it from the dentist office. And basically you put like a little dot. Don't fill it. I tell the patients, don't fill it, because you don't want to waste it. It's, you know, it's expensive, and if, you know, if it can last with you for like 2-3 weeks, why not? So you just put a little tiny dot. Basically, if the tray is like this, you put it like a little dot on the outside, like basically where the outside, you don't care about that, nobody's gonna look at the inside, but the outside, just a little dot, because once you wear it, it's gonna spread, and basically it's gonna work. I wouldn't even put it all the way in the back in the molar area, like, you know, the big molars in the back. Just do it from premolar to premolar, top and bottom, and you're good to go. And it you know, the material should last you for, usually if it's like a pen, it lasts for like 2 or 3 weeks. And you need to wear it like half an hour, and yeah, after that, of course, you have to rinse your teeth. Then there is after that, there is the over-the-counter, the toothpaste, the whitening toothpaste. So the whitening toothpaste, it works completely different. The in-office or the custom trays with the whitening gel, completely different mechanism. So the in-office whitening gel, it gets absorbed inside the enamel. It doesn't affect just the outside layer, but it gets absorbed inside. And it's always very important, if you get a cleaning done, like a professional dental cleaning done, before you get the whitening done. And why is that? Because you don't want any layer, like, you know, once you brush your teeth and you get a cleaning, so the biofilm is gone, and it comes back like within, you know, like an hour or so. So you better get it done like as soon as possible. I always recommend the patient, if you want some good results, you have to get your cleaning done now, and then right after that, we'll just jump in and do the teeth whitening. This is very important, okay? So this is the difference now between the actual whitening gel that's done in the office, because then the ultraviolet light, the blue light that comes, it stimulates, you know, the gel, and basically it creates nascent oxygen that gets incorporated inside the outer surface of the tooth, the enamel. It doesn't affect it literally gets absorbed within. Okay, I'm getting a little bit nascent oxygen. Okay, I'm talking like, but it's okay, guys. You need to learn. And then if you have questions, make sure you write them in the comments below. So as I said now, so that goes for the professional teeth whitening, and also for the custom trays with the whitening gel. And then what else? Then there are those tooth whitening paste, you know, over the counter. So these are actually not bad for maintenance. What does that mean? So it means you already got some whitening done, and you just need to maintain the whitening. So yes, it works, but the mechanism is a little different, because it works on the surface, the outside surface of the enamel only. So if you have a little bit of staining, it's gonna remove it. How does it remove it? Do you really want to know? Because it can cause sensitivity down the line. Because basically it has fillers in it, like large fillers, and how it works, it removes the outer layer of the enamel, and then little by little, okay, fresh layer underneath looks good, but then after that, the dentin underneath starts to show, which is more yellowish, and then you end up with more sensitivity and even more yellowish color that you're like, I never had that before. Well, now you do, because the protective layer is pretty much kind of gone. And that also works pretty much with those big DIY, oh, let me put some lemon and charcoal, because these are like really large, aggressive fillers now. And the problem is with lemon, it's acid. You're literally putting acid on your teeth. Why do you want to do that? This is gonna destroy the enamel completely, totally. If you are listening to this podcast today, this is the one thing you really need to listen to. Don't put charcoal or lemon and try to rub it against your teeth at all, please, because this will destroy you. This is called acid erosion. It's going to remove the layer of the enamel, and it's going to cause some serious sensitivity. I'd rather you just keep your teeth like you have a beautiful smile. Just keep it like this without destroying. Do it for your own dentist and for your own self, please. Just do not destroy your enamel, please. And then, you know, there are some you know, the whitening pens. I mean, these are good if you have, you know, some sort of a little event and you just put it. It doesn't really last for long, probably like an hour or two, and that's really it. But these are the major whitening products. And then there are those little LED. Now, those LED lights, I have to say something about them, because I know you can buy them online. It's anywhere, like you find them on Facebook, you find them on TikTok. Please do yourself a favor. and ask your dentist before you start using them, because you don't know what's in them. These are not FDA approved. We don't know what's the kind of gel is inside. So, I mean, at this point, don't do whitening at all, or get at least the toothpaste that's sold here. At least there is some FDA, done around it, but don't get something online. We don't know what's in it, and you can get some sensitivity or a reaction to it, and then it can really affect your gum. Remember what I said? Sometimes if the gel is too strong, it can burn, it can literally burn your gums. I don't want to scare you, but I don't want you to fall a victim for something like that. So these are basically the main category: the in-office tooth whitening, and then the custom trays with the whitening gel, and then the DIY charcoal lemon. Never, ever, ever. If you have somebody who's doing it, like a friend, just please tell them don't use it, and send them this episode. And if they have questions, they can always text me, or basically email me here. Then there is the toothpaste, and then there is those LED lights, or sometimes the pens and the toothpaste are pretty much the same. So these are the major ones. Now, some of the myths now, the very important ones. The whitening is gonna last forever. Well, nothing lasts forever, guys. I hope this is, I just wanna make it very clear. Nothing lasts forever, okay? Nothing. But if you get the in-office teeth whitening, that can last you for around a year. I would say between 8 months to a year. And I'm gonna talk about how you can maintain the teeth whitening for the longest time. But as I said, whitening does not last forever. This is a big myth, okay? You need to understand that. And if you are looking for white teeth forever, then you're looking for porcelain veneers, not even resin veneers, but you're looking for porcelain, because porcelain does not get stained. Composite or resin veneers, they will get stained over time. So that takes me to the second big point now. Once you get your teeth whitened at, the professionally done, don't drink tea or coffee or red wine right away. And why is that? Because remember, the nascent oxygen, and now the teeth are kind of porous and they can absorb. So imagine, okay, my teeth are pearly white now, and I'm going, with my friends at night to show off my white smile, and here I am drinking, having a glass of wine, and then all of a sudden they are getting discolored. Or I'm having tea or coffee. Of course, what is she talking about? I cannot survive. Well, me too. I cannot survive without my coffee in the morning. But what you can do is drink it from a straw. Straw takes it all the way to the back, and don't let it sit in your mouth. Just swallow right away. This is very important, guys, okay? If any of you, if considering teeth whitening, this is very important. Get the straw and start using it. I had a patient once. Now that was crazy. Got teeth whitening. His teeth are beautiful now, and he went and he had some Asian food, Indian food, and there was turmeric in it. And he came to me the following day. His teeth were yellow, yellow. And I said, what did you do? And he goes, and I said, didn't I tell you nothing that can stain but the food? And I said, well, there is a lot of spices. So make sure, guys, if you are gonna, getting some teeth whitened, this is a big part. Any spices that can cause discoloration, make sure you kind of stay away. And it usually takes around 2 weeks after, things kind of get settled. So if we are doing the in-office whitening, then after we do the whitening, we have to apply kind of a coating to seal the pores. Literally, it's called an oil, and it kind of seals everything together, so it prevents things from getting, trapped, like discoloration particularly. But remember, we said we're gonna use the straw. Now, what else? The touch-ups are usually done every 6 to 12 months, but you can do some maintenance with a whitening toothpaste. So let's say you had the big event and now your teeth are white, but starting to fade away a little bit. Get some, toothpaste, some whitening toothpaste, and you can use that. One of the big myths, it's about the sensitivity. So if you have sensitive teeth to begin with, in-office whitening is not for you. Okay, and I'm pretty serious about that. If you have any little bit of air, or if you already have some gum recession and you have sensitivity, it's not really for you, unless sometimes in our office we kind of cover those little areas. But I am telling you, if you have sensitive tooth to begin with, don't use any in-office teeth whitening. But I want to whiten my teeth, so what do? Your alternative would be get some custom trays and the bleaching gel and do it at home. So you're gonna get you're still getting the bleaching trays from the from the dentist, and then you're gonna put the the little whitening gel, but you can do this at your own pace. So you remember I said it takes like half an hour, so you put it in, your teeth are a little sensitive, you know what, skip a day or two and then do it again. You're still gonna get whiter, but it might take a little bit longer. So if you have an event coming up, you have to get yourself prepared like probably 2 or 3 weeks ahead of time to get your teeth whitened. Okay, so the sensitivity with the toothpaste, it is normal, because remember the pores opens up, and if you have sensitivity to begin with, don't do it. Okay, but it's not permanent. So sensitivity is not permanent with teeth whitening. It takes around a couple of weeks. You feel like a little zing, with air, or, if you're drinking something cold. And also very important, if you're going to get some teeth whitening, stay away from extreme temperatures. Too hot, too cold in general is not good. Mild temperature is okay. Like, don't get it and then get an ice cream after that. Of course, it's going to hurt you. Okay. So I hope this is kind of clear for now. Then, what about very important one now? If you are gonna get some whitening done, you should always consult with your dentist, because what if you have some fillings or crowns in the front? And some patients, they don't really think about that, and they jump in and do some whitening, and then they come and the 2 front teeth are dark while the others are white, and they're like, why did that happen? Well, because you have some fillings there. So if you are planning to, like, especially if you have a big event, you have to always consult with your dentist first. If it's good for you, if it can work, of course it's going to work, because I'll tell you how it's done. But let's say you have a couple of fillings in the front teeth and now you're getting the whitening, then those fillings have to be replaced right after the whitening is done. And why is that? Because we're going to have to match the color. So let's say you have like shade A2, which is a little bit on the yellowish side, and then your teeth are white and you are like in a B1 or 0, and when I'm talking like the shades now, and then you're going to have a filling that's going to match this, especially if you have a big event coming up. Crowns, porcelain crowns or porcelain fused to metal or zirconia, they do not get, they're not gonna get whiter. I'm sorry, guys. So if you are, and I always tell my patients, if you're getting crowns on your front teeth, between basically, I would do from K9 to K9. If you're getting any crowns done, you have to talk to your dentist if you are going to get some whitening done, or if you're thinking about getting whitening done soon or never, or what, because the plan, if you're getting some whitening done, then maybe you should put the crown, especially if it's on the canines or premolars, maybe a shade lighter, so that when you get some whitening, they kind of blend in. Don't go like extremely white and then you don't get a whitening, and then the tooth will be like the first thing people would see, and then will be like, what is that? Okay, so these are basically the important message today is teeth whitening can be done. It does not destroy enamel, as long as you are using the right material, as long as you're consulting with your dentist about which material is good for you. And also, don't get some whitening done and then go and get some red wine, and then your teeth are gonna be discolored again. Sensitivity is not permanent, and the proper way of whitening teeth, it does not destroy your enamel. Okay, I hope it was fun today, at least. I mean, yeah, I get a little too excited sometimes, but I just have a lot of knowledge and information, and I have seen a lot with my patients. So if you like this episode, or if you think, okay, I have some questions, please write them below here, and make sure you like, subscribe, and share this episode, and I'll see you again soon. Make sure you take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.